NPI, National Provider Identification Numbers, are required if you are someone who has to be HIPAA compliant. Okay, so if you're in an agency that's required that has an NPI number, great. If you're in private practice as well, or you're working for as an independent contractor and you are required to be HIPAA compliant through that process, then you'll need an NPI number as well. If you are in another setting, for example, if you have an agency NPI number, you're going to need to have your own NPI number for your private practice, okay? So it's a separate NPI. Now, I'm assuming that most of you have at least heard about this, but I didn't talk about this in my web lecture. So let me back up for a second and describe what this is. This National Provider Identification Number is an attempt for those who are using the web and using technology to provide services or to do administrative and financial activities related to healthcare. For those people who have to be HIPAA compliant, we're required to have these numbers, okay? And the deadline was in May, I think it was May 23rd, to sign up if you're already someone who is a HIPAA-based provider. There were some not so minor glitches in the process where they apparently asked for information from people and are now publishing it as of the end of this month, or actually just a few days ago. And for those providers who gave home addresses and so on, it caused quite a bit of distress. So they gave the opportunity to have people go in and modify the information they provided in their NPI service number and identification information, and that is now public access information. Okay, so the NPI, we're all supposed to have it if you have to be HIPAA compliant. However, if you don't have to be HIPAA compliant, you don't have to have an NPI. Insurance companies are going to start requiring those of us in private practice, even those of us who have refused to do computer-based work, are going to start requiring us to have an NPI. So you got to go online and get one if they require it, and if we need to get compensation for clients through that process. And NPI numbers, the National Provider Identification Numbers, are required if you have to be HIPAA compliant. And that includes private practitioners, it includes agencies, it includes hospitals, and so on. So if you do billing and you bill under your license, then you're going to need an NPI if you have to become HIPAA compliant. Now, I'm assuming that many of you know about what it takes or what's required for HIPAA compliance. Just to summarize, the basic idea is if you use electronic means of communication or transaction regarding patient healthcare information that's identifiable, so names, identifiable numbers, social security numbers, that sort of thing, and you do it and you're communicating about administrative or financial information related to healthcare, then you've got to become HIPAA compliant. So what this basically means is if you're using the web, or the agency you're working with or organization you're working with has a network, and you're using the web or network to transmit identifiable patient information, and you're having transactions with other parties about it, then you have to become HIPAA compliant. And you then have to get an NPI, a National Provider Identification Number. What if you are not on any insurance panels, but your client is using your invoice? Do you need an NPI number for them to get reimbursed? I'll give you a very lawyerly response, even though, as you heard in my previous lecture, I'm not a member of the bar. It's going to depend. The insurance company may demand it. They may say, we will not allow you to submit this bill or get reimbursed if your provider doesn't have an NPI. It's going to depend on the insurance company, and if you don't currently have an NPI in your private practice and you'd prefer not to get one, or you're not required to have one because you're not a HIPAA provider, then have the client fill out their own paperwork and submit the bill that gets sent to them, to the insurance company by them, that you send to the client that gets sent to the insurance company, and see if they'll reimburse. And if they won't, then you know that if you want to see a client doing that, you'll need to, that is, engage in that kind of reimbursement process with that particular insurance company, you'll need to get an NPI. What's the downside of having an NPI? Well, you know, it's hard for me to talk about this without getting political, so I'll go ahead and get a little political. Whenever the government has additional information on us, it allows us to be more monitored and have less privacy as citizens. And so we all have Social Security numbers. NPIs are another number for us to use and by which we can be identified. There are some benefits, to be sure, but the NPI, I think, can to some degree increase in a slight way a compromise of privacy for people who are providing services and really don't want to be on the federal radar. Having said that, it is so difficult to maintain privacy in our lives, both as personally and professionally. I think that the risk with an NPI is relatively slight. Further, the emails are not private at all, and not only commercial, but governmental agencies can and do regularly monitor and data mine our emails and our transactions and our web visitation processes. So we can be tracked in terms of where we have visited on the web. And these are all used in the service, at least the argument is, in the service of national security. And so we are very vulnerable to information about us being available internationally and on the web. And the NPI has a slight increase in that vulnerability, but not hugely so. So that's the downside of NPIs. Yeah. The upside of an NPI is that it will facilitate recognition as a provider, and actually there are one or two others I think about it, but it facilitates recognition as a provider. It will facilitate payment, so there are some benefits. Another downside is they ask us for essentially our specializations, what it is that we focus upon. And you know, if you do kind of a generic or general clinical practice, it can limit us to some extent. Again, you can check more than one, but still one might have to, as we do with insurance panels, be designating ourselves in areas when we might prefer to be a more general practitioner. I have an NPI number. Does this mean that I have to become HIPAA compliant, even though I absolutely do not use any business-related electronic billing or transmission of client information? Well, this is where the Garden of Eden analogy breaks down, because the NPI number does not require that you become HIPAA compliant. It's if you are required to do HIPAA compliance, then you're required to get the NPI. You can get an NPI and not have to be HIPAA compliant. Okay, so it doesn't work in both directions.